Good evening. You're watching The Big Story. I'm Haryanto Diman coming to you live from the Straits Times newsroom. If you are new to this channel, do tap on the red subscribe button down below. The Health Ministry has confirmed 528 new COVID-19 cases as of noon today. It's the 7th consecutive day where the number of new daily infections is below 1,000. Of the new cases, 6 are Singaporeans and permanent residents. Migrant workers living in dormitories continue to form the bulk of the remaining cases. The ministry said more details will be released later today. The total number of cases in Singapore now stands at 16,169. It's almost 100 days since Singapore saw its first COVID-19 patient and the virus changed life as we knew it. It may feel like a long time ago when Singapore had its first confirmed case on January 23rd. Fast forward to today, we're in circuit breaker mode, which was extended to the 1st of June. While the Health Ministry has said that the average number of new cases each day in the community has dropped, the infection rate among migrant workers living in dormitories remains a concern. The nation's fight against COVID-19 is far from over. So what have we learned about the virus in these 100 days? And what would the next 100 days look like for Singapore? To answer these questions and more, Executive Editor of the Straits Times, Sumiko Tan, speaks with Singapore's Chief Health Scientist, Professor Tan Chaw Chuan. Professor Tan was the Director of Medical Services during the SARS outbreak in 2003. He also talks about how lessons from the SARS crisis have helped in the war against COVID-19 today.
Thank you, Prof. Tan, for making time for us today. Could you explain what your role is exactly as Chief Health Scientist, especially when it comes to managing COVID?
So as Chief Health Scientist, my main role is to set the research agenda and to work very closely with researchers across institutions in Singapore to address the high priority public health and clinical needs. So I do this in 3 main ways. The first is I work with the COVID Research Working Group that is coordinated by NCID. And it is one of the major fora where researchers, clinicians, public health experts, and researchers come together, sharing samples, collecting information, and doing research together. The second way is we have put aside between MOH and the National Medical Research Council $20 million as a special COVID research fund. And we've had 2 grant calls so far and funded a number of research projects that have direct relevance to our containment efforts. And the final one is I work very closely with our researchers, clinicians, as well as A-Star to expedite the development of diagnostic tests, of treatments, and to try to bring them quickly to become products which can then be used at scale in our hospitals and public health intervention operations.
I see, and that's very interesting. And you do it all from home now?
We do it largely from home.
Okay.
At the beginning, we had physical meetings, but now it's almost entirely by video conference.
I see. And, Prof. Tan, do you remember, where exactly you were when news about COVID first emerged?
Yeah, when the news first emerged, as you recall, it was reported to have very limited human-to-human transmission. It was initially believed to have jumped somewhere from an animal to man, but the initial reports were that it was limited human-to-human transmission. So at that point in time, it wasn't such a big worry because we've seen this also with bird flu and others, where there's no efficient transmission between people. But once the reports started that human-to-human transmission was occurring and clearly was quite efficient, then that was the part where we all got worried. And I'm happy that in Singapore we took it very seriously and that defenses were stood up and our responses the alert levels were lifted very early.
Right. It's been said that, we had learned many lessons from SARS, and during that time you were the Director of Medical Services. Could you maybe elaborate a little bit more on what sort of lessons we put in place?
I think there were many, many lessons that we learned from SARS, which have been beneficial to us. I would say that perhaps the most important one is we now have in Singapore many individuals who are administrative leaders, clinicians, nurses, professionals, frontline workers, administrators who have had experience of dealing with an epidemic, who have the confidence and the knowledge of what to do. And because of that, they have also less concerns about getting infected themselves, greater confidence in the protective equipment, and therefore somewhat less anxiety. So I would say that amongst all the different things that came out of SARS, I think that is probably the most valuable one. Of course, we did also build many new systems. We developed research, contact tracing capabilities, but all those things were actually support a human resource that is very experienced with dealing with epidemics. Now, SARS was very difficult because we did not have a diagnostic test until more than after a month. And this made it very, very difficult to identify cases, made it extremely difficult to quarantine people, to conduct public health operations. And SARS was a more severe disease. It mainly amplified within healthcare settings, meaning that it spread typically amongst healthcare workers, and then from healthcare workers and patients to other health facilities. And that was one of the reasons why it created a lot of concerns among healthcare workers. But having said that, because it was largely amplified through hospitals, once we were able to get infection control really stringently up in the hospitals, once we were able to curtail the movement of patients and healthcare workers, and we were able to quarantine people very quickly, the outbreak actually was quite quickly contained. I think COVID is very different because SARS was a hospital type of infection. COVID is a community type of infection. And it has a number of characteristics that make it actually much harder to control. Spread occurs very early on in the course of disease. It spreads in the community. It spreads through widespread contact between individuals who are circulating around. And therefore, unlike hospitals and healthcare facilities where you're able to bring public health measures to bear in a very concerted manner, this is a much more diffuse problem. And as you know, we've had to do many things that we didn't have to do in SARS, such as social distancing and restriction of interactions as part of the containment efforts.
I see. And in terms of the medical community, what has been the aspect of COVID that has given you the most sleepless nights?
I think the main part of COVID is its infectiousness, its ability to very rapidly spread. If you look at some of the doubling times, it can double, the number of cases can double in 6 to 7 days, which means that the number of cases can rise extremely quickly past a certain initial point. So that makes it actually very problematic. And because of the nature of spread within the community, basically what it does is traces all the complex types of interaction between many, many individuals and communities all around Singapore. And therefore, you see unexpectedly cases coming up in different places at different times. And so this makes the whole containment effort very difficult because we know that the nature of human interaction is complicated and it's actually very hard to trace down even with expert contact tracing teams. So these characteristics actually make it much harder to deal with. And of course, what makes us all lose sleep is the constant worry that we will have big explosive clusters that become very hard to control. Because once the numbers go up very quickly, and if many of them are severely affected, then they will overburden the healthcare system, and that's where outcomes will be worsened and mortality may increase.
At what point did we realize this about the virus, and were we prepared for it?
I think we were learning a lot about this virus. I would say that since late March and early April, I think we were understanding the ease with which it was transmitted and the way it was working itself around the community. And of course, when it got into the foreign worker dormitories, I think that's when it really created a very rapid transmission within a densely populated community, and which now dominates the outbreak in Singapore.
Right. Did we foresee the foreign dormitory problem?
Well, I think when it first started, which was in the late part of March, we were actually very aggressive in containing it. We isolated people very quickly, and we quarantined actually large groups, even without going through contact tracing, because it would have taken too long. So we will quarantine off whole floors within dormitories. And initially, that appeared to be containing the problem, because it appeared to be able to restrict the number of cases. But then later, of course, the spread occurred also through workplace and social types of contacts of the foreign worker community. And then it started spreading to more dorms. And within dorms, some of them, they also spread quite quickly within the dorms. And so that's, I think, when, we were really starting to be concerned about the situation. I would say that the silver lining is that thankfully, the vast majority of patients have few or no symptoms, and only a small number have had more severe disease. So I would say that this is something we are very thankful for. It's very fortunate. But of course, we still are continuing to do our best to contain the magnitude of the outbreak.
Right, and Prof. Tan, we've seen foreign dormitory numbers in the hundreds, for quite some time now. Might there come a day when there's 0 cases?
Well, I think that eventually it will come under control. We are seeing very large numbers now because the very active case finding is going on. We are having a very low threshold for doing swab diagnosis tests for people with respiratory symptoms. We also have systematic testing operations in some of the dorms. We are very actively trying to find cases so that we can isolate them so as to reduce the extent of spread. So we expect numbers to continue to rise because active tracing. But I think in part because we are finding these cases very early, many of them with very little symptoms, it accounts in part for the relatively milder course of disease that we are witnessing today. When we have eventually been able to identify and take out most of the infected cases, we expect that the numbers of new infections ought to start to taper down, but it may take a few more weeks before we get down to a low enough level that would signal that the outbreak within the dorms is well under control.
Right, but what happens next? If the dorms have much fewer cases, would the workers then be allowed to go back to work, for instance?
Yes, I think so. And in reality, there are different dorms, some with which are more affected than others. And within dorms, there are some blocks which are more affected than others. And therefore, I foresee that we might have a situation where some workers who are in less affected dorms, who are tested negative, and we are confident that they are not infectious, they might be able to return to work and return to the community earlier. Within dorms, some dorms that don't have very many cases, as we test the workers and clear them out. Some dorms or some parts of the dorms could be reopened gradually. In some of the more affected dorms, it will take a longer time because the caseload is higher, transmission is higher. Testing will have to be done again for many of the residents in these dorms to ascertain their infection status. And those who have been exposed, who are no longer infectious, it ought to be safe for them to return to work and to the community. So it will not, I think, be a situation where all dorms are closed and all dorms are open. It will be a situation where workers who are assessed through testing to be safe can be returned to work and the community, but living separately from those who might potentially be exposed or infected. And then dorms or parts of the dorms could gradually have their quarantine lifted once we are confident that there's no more active transmission in the dorms.
I see. And, Prof. Tan, what does the science tell us about immunity?
So right now, we have antibody tests that can detect the presence of antibodies. And what they tell us is that somebody has have had a recent infection. These are not useful for immediate diagnosis, but they are useful for us to pick up people who have been exposed. Now, being exposed and having antibodies does not equal to being protected from further infection, or if you get a further infection, that it will be much milder. For that, you need a certain type of antibody that actually neutralizes the effects of the virus. So the good news is that one of the antibody tests, which has been developed by Professor Wang Linfa in Duke NUS School of Medicine, is able to detect antibodies that are protective. And we will need to do some studies to assess the value of this test in assessing whether people are protected. The other thing that we do not know yet about immunity is how long-lasting it will be. The experience with other types of coronaviruses suggests that immunity could last from months to maybe over a year, but we don't know if this is the case for COVID-19, and it's certainly something that we will really have to ascertain in the coming months.
Right. Some, experts have described this virus as a very smart virus. Do you agree?
It is actually a virus that's been designed to be difficult to control because it can spread before people have symptoms. There's likely to be some asymptomatic spread. The amount of virus shedded by patients is highest very early at onset of disease. So all these things make it very hard to control, and which is part of the reason why we have difficulty in closing down on outbreaks as quickly as we would like to be able to do.
Right. Would you say it's a smarter virus than the Sars virus?
I think so. The Sars virus, actually, when we were dealing with it, we had many fears. We feared whether asymptomatic spread was possible because the measures that we were taking for SARS were predicated on people being sick before they became infectious. So we worried a lot about whether people with very few symptoms could transmit the infection, but luckily it did not prove to be the case, and therefore, the whole world was able to contain SARS quite quickly. So in that sense, yes, it is actually a much more tricky virus than the SARS virus.
Right. And, it's been 100 days since Singapore saw its first patient. How would you describe these 100 days?
Well, I think it's been a big learning curve. The fundamental problem that we have is that it's a novel virus, so none of us have immunity against it. We have to think about this on a long-term basis because even if we are able in different countries to control viral spread, we are all ultimately susceptible to infection. And when the world reopens, as it will have to, imported cases will return, and therefore populations become exposed again. And therefore, I think we have to think about this as a long-term issue and not just as a short-term one. I think the 100 days have been very, very valuable in terms of learning about the virus, the way it spreads, and the way it's contained. So one of the important learning points is that safe distancing itself within the community is very helpful because it prevents spread within social gatherings, within workplaces in the community. But it doesn't really work as well in certain circumstances, as we've seen in special communities like foreign worker dorms, in construction workplaces where workers from many different companies and sites work together. So these are all situations where just applying rules of social distancing might not be as effective. And therefore, I think one of the things that we've learned in the last 100 days is we need to take one step beyond social distancing to what may be called safe management. Safe management. In other words, each of us, whether we are in organizations, institutions, companies, particularly larger ones with more complicated operations, we really have to look at the sources of risk of transmission within the work that we do, with the partners that we have, through the way in which we deploy our colleagues, and to actively take steps to mitigate these risks. So if we combine safe distancing, which works very well for community protection, for social gatherings, and in many workplaces, and we combine it with safe management by corporations, organizations, and companies, then I think we'll have a more robust way of reducing the risk of outbreaks from becoming large.
Right, and this would have to be the new normal till a vaccine comes into the picture?
I think so. I think until such time we have enough immunity amongst the population, hopefully through a vaccine, then I think these measures will be necessary to prevent and to limit the extent of spread through this viral infection.
Okay, and maybe the final question for you is, looking ahead to the next 100 days, are you optimistic that things would be a little bit more normal?
Well, I think the good news is that we're seeing examples all around the world that the viral outbreaks can be contained. That's good news. They can be contained, and if you contain them well, the health system need not be overburdened. And in Singapore, we are thankful and fortunate that our health system has not been overburdened, that our mortality rates have been low so far, and that we have not had a lot of severe illness amongst the younger foreign worker population. So that's the good news. The bad news is that this containment requires a very, very stringent actions, including shutdowns, circuit breakers, which interrupt the normal pattern of living, interrupt economic activity. And so I would say in the next 100 days, all of us are searching for ways to reach a new equilibrium, a new balance where we can still keep viral spread under control. We may not be able to completely get it down to zero, but we keep it well under control. But in exchange, we are able to function much more normally, and the economy can function more normally, but with a lot more precautions in place. So that's the new equilibrium that all of us are searching for. And I'm hopeful that in the next 100 days, we will be able to learn, to pilot, and to institute new ways that will allow us to gradually do this better. But I would say one final point here, that we must never be complacent. As you've noted, this is a very smart virus. It still has many tricks up its sleeve, and therefore we have to be really very vigilant. We have to respect our enemy, and therefore we have to continually keep our guard up.
Right. Thank you very much, Prof. Tan, for sharing with us your views. You know, we are living in very strange times. Wish you the best. Thank you.
Thank you very much, Sumiko.
And that was the Straits Times Executive Editor Sumiko Tan with Singapore's Chief Health Scientist, Professor Tan Chaw Chuan, as we approach the 100-day mark since Singapore saw its first COVID-19 patient. You can read more in the special package COVID-19 The First 100 Days in the Sunday Times this weekend. For COVID-19 updates in Singapore and around the world, visit straitstimes.com. And if you are new to this channel, do tap on the red subscribe button below. On that note, do keep tabs on our social media channels as we will be coming to you live later as PM Lee delivers his May Day message at 7:30 p.m. Followed by a special broadcast of a live concert, International Jazz Day 2020 at 8:30 p.m. Once again, I'm Haryanto Diman. Stay safe and have a good long weekend.